I'm doing my PhD research within the Pride 3 project that's led by Yale University in Eastern Europe and Central Asia, covering 4 countries: Georgia, Moldova, Uzbekistan, and Tajikistan. The principal investigator of this research implementation research program is Dr. Frederick Altis and Dr. Lynn Maiden. Also, the country PI is Dr. Irma Kitadze, and Dr. David Otiashvili is also engaged in this project as a researcher. So I'm extremely lucky that I have opportunity to work with these people and do my PhD with them. So thank you very much for everything for all the support and everything that you have done so far in this regard. As I mentioned, this is a huge project which focuses on the prison and probation in other countries. However, within my PhD research, I will focus on the only probation issues in Georgia. So, how you doing? Okay, welcome. So, even though the global incidence rate of HIV is decreasing, Eastern Europe and Central Asia host the largest and most dynamic HIV pandemic globally, driven by a large number of people who inject drugs and their sexual partners. Fortunately, the prevalence of HIV infections in Georgia is quite low among the general population. It is predominantly concentrated in the vulnerable population, like people who inject drugs. So the prevalence of HIV in PVID is 3 times more compared to the general population. And meanwhile, we know also that Georgia criminalized drug use, and resulting in the high rates of people who inject drugs in prison and probation. Every year, each year, approximately 20% of all probationers are on probation due to the drug-related offenses. And those number is quite high. It's about 5,000 people every year. But we cannot say for sure that all people are using drugs, but they have the higher risk to use drugs. So, and also I would like to mention that there are 3 factors. So we have the injecting drug use, we have the incarceration settings, prison, probation, and the correctional settings, sorry, and we have HIV. And when we have these 3 factors, it has syndemic effect. So the risk of transmission from HIV goes up. So what we can do in this regard, and what is the best practice to mitigate this risk of HIV in this target group in this kind of situation? So over the 15 years of research confirms that OAT, which is widely available in Georgia, is the most effective treatment for opioid use disorders and can significantly impact HIV infections reduction. So, however, the linkage between the probation system and OAT provider is quite poor, resulting in the high risk of HIV transmission among probationers with opioid use disorder. So our goal is to identify barriers and facilitators to scale up OAT for HIV prevention in the probation system. To do so, we're going to establish the SPIRT intervention, which stands for Screening, Brief Intervention, and Referral to Treatment, which is an evidence-based public health approach to identify people who use drugs at different levels and at risk levels. So in the process of development of the SPIRT intervention for scale-up OAT, we use 2 approaches of implementation research design. Well, the one is the EPIC framework that has been mentioned many times. So this framework will help us to identify inner and outer factors and bridging factors, and also to engage the stakeholders in this process, in the implementation research process. And within this framework, we use a NITEX model, which is the bundle of implementation strategies that really fits very well in this framework. And that will help us to improve the scale up of AT and the implementation of the SPIRT and the probation. So first of all, we established the NITEX collaboration, which include the executive sponsors. In this case, executive sponsors are the high-level decision makers of probation in the Ministry of Justice. And also we have the administrators, which are the middle level of managers. And after that, we created the change teams, which consist of probation officer, social worker, psychologist. So we have 6 change teams in 6 different regions. And the main criteria why we have only 6 teams is that the OAT, in the same region, there should be OAT treatment available as well. So we need some probation branch and also the OAT program available in the same region in order to have the change team. So, and we are going to use the different tools of NITEX like NGT, PDSA cycle, walkthrough, flowchart, change team form, and so on. And now I would like to talk on how we are going, what is the time frame of the implementation. As I mentioned, we have created change team. So every month we will have online meetings with the change teams in order for coaching, in order to address all challenges coming from their daily work, and also in order to measure the outcome and how what is the outcome over time and how these things changes. We are going to collect information from probation, which is routinely collected by the probation, and we will share some special forms, and they will fill every month, and they will submit it at the end of the month or at the beginning of the month. We have not started yet. So every 3 months or several months, we conduct this structural surveys among probation staff in order to explore the attitudes and beliefs and prejudice of the probation staffs toward the people who use drugs, and also toward evidence-based programs like SPIRT, like opioid agonist treatment, etc., in order to see how the thing changes over time. And every 6 months, we use NGT sessions, and based on the NGT sessions, we will develop PDSA cycles. So when it comes to barriers and facilitators to implementation, on Monday, we conducted NGT session. So I brought here some the barriers and facilitators that we from this NGT session. We participate in the change team members. So they listed some barriers and then ranked them. So the most ranked barrier was probationer trust issues, stigma and fear, and also the lack of information on drug-related issues and the treatment services. This is the qualification issue of the staff. And also they mentioned the lack of human resources, lack of willingness and readiness to enter treatment, confidentiality issues, also the workplace infrastructure. So for example, some of them mentioned that they have limited physical space. This is really challenging because some of them, they do not have the private space to talk about the drug use, and that is kind of challenging for them. And also they list down some facilitators and they change it. The first one is the most voted one is changing the state policy, addressing the stigma, raising awareness about the drug-related issues among probation staff, also the memorandum for understanding between the OAT provider and which is the Center for Mental Health and Prevention of Addiction, might improve the situation in this regard, and staff increase also and improve the work and labor condition. As I mentioned, if they will have the private meeting rooms, it might be helpful for them, etc. So the anticipated challenges, a question. We have different type of levels of challenges. The first one is the policy level challenges and punitive rather than supportive national drug policy, which we are facing now, may increase stigma against people who inject drugs and discourage disclosure of drug use, and also decrease the accessibility to treatment services. We have also institutional level barriers. For example, the management turnover in the probation system is kind of challenge that might occur also because we have already faced once during this year, and it prolonged some processes. So also we have the individual level barriers. For example, the negative personal attitude toward people who use drugs, and but we are going to work with them, provide all information, coach them. So we will assess this, how their attitudes changes over time. And also the last one, data collection challenges that we might face. It's incomplete data. They do not collect all necessary information. We do not have information on some key variables that we want to collect in order to monitor the outcome. But we have close cooperation in this regard with the probation. So they are trying to improve data collection in order to provide all necessary information for us for further measures. And the final one, the conclusion, the next steps, we're going to the implementation data collection process. From the next month, we are going to start a coaching session with change teams. Also, the change team will prepare and kick off the first plan PDSA cycle. Also, they complete the data collection form to start data gathering in probation. Actually, we together complete this data collection form, which is in Excel, and then we started the data collection process in August. And also conduct next round of the structural survey using Qualtrics. Maybe we will do it after a few months. And also we will prepare for the upcoming NGT session in 6 months. As I mentioned, we're going to conduct it every 6 months. So we conducted it on Monday. So the next one will be conducted in January and February. Let's see how it goes. So thank you very much for your attention. That's all.
Thank you, Leon. Thank you so much. Any questions, comments?
So thanks for putting that together and sort of laying out sort of the sort of next set of questions. One of the things to maybe think about is you've got some preliminary data from the NIATEX. And, can you put that slide back up? Because I think it's useful. I don't know if they're in order. That one, yeah. Yeah, and so, one of the things that you want to sort of maybe think about in terms of being able to dig a little bit deeper and figuring out how to overcome some of these things is, let's just say number one, and this is really for teaching purposes for everyone, but try to focus on things that people think are big issues. So, that's the learning issue. And I think if Lynn would have had her slides up yesterday, she would have spent a little bit more time on that. But, this trust issue, and one of the unique things about probation is maybe digging into that relationship between the probationer and the probation officer in terms of how that might be a driver. That is a really, really important thing because, it changes how you implement. And one of the other things that I would sort of say that, in parallel to this kind of work, where you're getting some stuff, in terms of the barriers from the probation officers, is what does it look like from the patient? And, in NIATEX, the first principle is, understand and engage the customer. And you've got the clients who are going in. So and that's not just NIATEX, but I think in general, most people feel like if you're doing some human-centered design, that you really want to involve, the multiple stakeholders because many of them all have a role in this and somehow making it work. What is it that comes up for them? And, it's an interesting thing. A lot of times when we do this work, we find that the clinicians are always blaming the clients and the clients are always blaming the clinician. And this may be one of the places where there's complete concordance. And that's an interesting finding because you have a single approach to try to figure out how to solve. So I would say use what you've got here, build upon it, really think about what is going to be for your analytical processes, because I would say this is a starting point, and my comment is always, what next? Because my last lecture on sustainability is you have to keep doing things differently in order to get where you want. Because if you solve this trust issue, there's going to be more issues for sure.
Thank you, Levon. This is a really interesting presentation and data in real time, right? Data is your friend. So it's always great to see that. I would actually back up to the problem statement. Can you click backward? Because I feel like perhaps you're making an assumption there, right? No, the next slide. Yeah, the linkage between probation and OAT provider is poor. So that I don't think is the actual problem. It still might be true, but I think that the issue is that the touch point of probation, we don't use that opportunity to identify people who might have opioid use disorder. So that's the first step. And then we would help them navigate to opioid use disorder. So this might be this is, in fact, a real problem, but it's not the problem statement that has actually precipitated the study as a whole. Does that make sense?
Yeah.
Yeah, so refine that a little bit would be my suggestion. That's going to come up, and that's going to be an action step that probably will have to be undertaken, but that's not the starting point.
Yeah,
Yeah.
for sure.
Yeah,